Hello, everyone. I'm Joseph Rickert, a director at the ARC Consortium. So welcome to the COVID-19 Data Forum. This forum is a collaboration between the ARC Consortium and the Stanford Data Science Institute. It's an ongoing series of webinars and online discussions that bring together experts from multiple disciplines who are working to collect, curate, share, and the data we need to drive scientific research and formulate an effective public health response to the pandemic. Today's webinar, Mobility Data in Monitoring and Forecasting COVID-19, will focus on the special features of mobility data, the technical challenges, the social issues involved, the promise these data hold for helping to combat the pandemic. The topic is especially relevant in our situation today. Here in the United States, we are in the middle of an unprecedented natural experiment. Against the recommendations of the CDC and other health authorities, approximately 50 million people traveled over Thanksgiving, and many are likely to travel this month for the holidays. The mobility data that is being generated this holiday season will likely be studied by epidemiologists and public health experts for years to come. We are fortunate to have three speakers today. Caroline Buckee, Associate Professor of Epidemiology and Associate Director of the Center for Communication Disease Dynamics at the Harvard T.H. Chan School of Public Health. Luca Ferretti, a Senior Researcher in Statistical Genetics and Pathogen Genomics at the Big Data Institute at the University of Oxford. And Dr. Andrew Schroeder, Vice President, Research and Analytics for Direct Relief. Our moderator today will be Dr. Chris Volinsky, Assistant Vice President, Data Science and AI Research at the Chief Data Office of AT&T. Each speaker will have approximately 15 minutes for their presentation. Immediately after the last presentation, our speakers will participate in an open discussion during which they will take questions from our audience. Please use the Zoom Q&A tab to submit a question. Chris Volinsky, our moderator, earned a PhD in statistics from the University of Washington. He has been with AT&T Labs for over 23 years and has held several senior leadership positions. In 2009, Chris was part of the 7-person team that won the $1 million Netflix prize. Today, as Assistant Vice President for Data Science and Research, he heads a 50-person team that analyzes data from AT&T's vast network. His research focuses on large-scale analysis of mobility and entertainment data used in a range of applications, including network optimization, fraud, anomaly detection, and customer personalization. Please welcome Chris.
Thank you, Joe. Happy to be here as part of the panel, moderating this panel of great speakers that we have. For those of you who are just joining, I just want to make it clear that we have had some technical difficulties in having the speakers' videos to show, but we will be sharing their presentations and those will be visible to everyone. So, hopefully that will make the forum a great experience for everybody. So I'm really happy to be moderating this particular group of 3 speakers. We have had a change. You may have seen in the initial advertising, Christoph Fraser was going to be one of our speakers, but he had to get called away, and Luca Ferretti is stepping in as our second speaker. But as our first speaker, I'd like to introduce Caroline Buckee. Dr. Buckee is an associate professor of epidemiology at the Harvard School of Public Health, where she is also the associate director of the Center for Communicable Disease Dynamics. Her research focuses on understanding the spread and evolution of infectious diseases such as malaria, Ebola, dengue, and meningitis by combining mathematical models and big data. Dr. Buckee is one of the pioneers of using mobility data to track the spread of infectious diseases and has written extensively on the promises and challenges of applying mobility data of the COVID-19 pandemic. Along with Dr. Schroeder, Dr. Buckee leads the COVID-19 Mobility Data Network. So she is a perfect person to be kicking off our panel, and I will hand it over to Caroline now.
Thank you, Chris, and thank you for having me. Let me see if I can share my screen. Okay, can you see that? We're all set?
Yes, we can.
Okay, so I'm going to talk today about mobility data, the different kinds of mobility data, the phenomenon that we've seen happen to what was prior to 2020, essentially quite a small and niche field, into very mainstream use of these data sets in the context of COVID-19. And one of the most obvious reasons that we use mobility data is because fundamentally part of our surveillance for this new virus is trying to understand how many people are getting infected and the human behaviors that drive the contact patterns that underlie transmission of the virus. So our surveillance systems generally rely on confirmed cases. So as the epidemic increases, we look at how many cases have been confirmed by PCR. But of course, those cases are just a subset of the total number of people infected, because many people have no symptoms or don't get a PCR test, and they occur at a time lag to the actual transmission event. Deaths can be more reliable in a surveillance system because they're easier to count and attribute in some cases, not all, but they are even more delayed, and it's a smaller subset of those who are confirmed. So really we want to get at the transmission that's happening in real time and try to understand which kinds of human behavior patterns are reliable proxies for transmission events, so that policymakers can make decisions in near real time and be better informed about what's going on, especially in the context of an emerging infection like this, where our interventions are not pharmaceutical. They rely on behavior change and things like travel restrictions and social distancing and lockdowns, where human behaviors like mobility are going to change dramatically if compliance is high. So I'm going to limit my discussion today to the kinds of mobility data that we use to look at transmission broadly on a population level. So not contact tracing data or individual level data, but rather transmission, behavioral patterns that underlie sort of general patterns of transmission in a population. And then the mobility that underlies the spread of the virus between populations. So trying to understand the spatial dynamics between towns or cities or countries. Now, prior to 2020, like I said, there was a rather restricted and difficult to navigate process to access this data. But we've seen an absolute deluge of information on human mobility from mobile phones, coming from Apple and Google and SafeGraph and Mapbox, all of these different kinds of companies that are now making their data available. And what comes with that is a huge amount of promise, but I think we still have a long way to go before we can routinely use these. And I just apologize for the puppy in the background. I can't control that. So Andrew Schroeder is going to talk in a few minutes. And so I won't belabor this point, but we, as a group, we've been trying from the beginning of the pandemic to really move this whole field into a translational pipeline, analyzing what data sets need to be in place, what data use agreements need to be there, and then thinking hard about the methods that we have and how those methods are going to produce results that are actually useful to policymakers. And I think this is going to be a huge field for research moving forward. We really need to understand which of the academic scientific methods that we have are actually useful in real time for decision making. So any of the mobility data sets that you would look at would have shown some general trends from this pandemic that have been very useful to try and understand what's been going on. So this is data from Facebook from 3 different states. And you can see that in mid-March, across the country, actually, almost synchronously, there was a large drop in mobility. And these metrics, you can see on the y-axis, it really doesn't matter how you measure it. There was a big change in behavior around the middle of March, where the state of emergency was declared and the NBA season was cancelled. Since then, we've seen a return to near normal levels of activity. And these are things that we can monitor on a broad scale and look at heterogeneity between counties and so on, depending on data coverage. Some of the general findings of these analyses have been that cities have emptied out. We've seen a large movement from urban to rural areas. This shows movement out of cities around the US, where the y-axis is the percent change in the nighttime Facebook population. So that's, we think, residents. So a lot of people have just moved out of cities, and this has happened in a very heterogeneous way. So this looks at New York City, and you can see that the percent change in the population is really focused on some neighborhoods. So Manhattan is really empty, and other neighborhoods have not shown any change or even increases. And so this has been something that we can keep track of, and it helps us to understand our denominators. So when we calculate at-risk populations, we can learn from this kind of data in real time, look at the dynamics of the shifting denominator. This isn't just in the US, this has been a global phenomenon. So here we're looking at Facebook population change along an urban-rural gradient in France, India, and Spain, where we separate out our districts into those with more nightlights, so those are urban areas, and less nightlights. So this is measured using satellite data. And what you can see is when lockdowns and social distancing interventions were implemented, we've seen a dramatic reduction in the population in urban centers and a move to rural areas. So this has important implications, not only for trying to understand the shifting at-risk population, but also for thinking about the possible spread of COVID out of cities at a faster rate than we might have anticipated. Interestingly, even on a local scale, we can start to see that movement patterns measured by these types of mobility data correlate strongly with transmission. So this was a study from New York City, where we looked at PCR positivity among women delivering babies around New York. And you can see that there's striking heterogeneity in the prevalence of COVID in different parts of the city. And when you look at how that relates to commuting movements from mobility data, so looking at movements out in the morning and in the afternoon, it's very strongly related to that. So we think that these types of data can tell us about the populations that are at highest risk for transmission and elaborate on some of the reasons why. And here, you know, essential workers have not been able to do social distancing in the same way. They have to continue to go to work. And again, this is an international phenomenon. So this is data from Chile, from Santiago in South America. And if you look at counties around Santiago, around the city, you look at administrative units by socioeconomic status, and then you look at how much they reduce their mobility in response to lockdowns. What you can see over time is that places that have low socioeconomic status have been unable to reduce their mobility as much as higher income locations. So this has been a general phenomenon that we've uncovered with this kind of data that would be hard to look at in any other way. The figure on the right here shows just the relationship between the average reduction in mobility and socioeconomic status. And so this link between mobility patterns and transmission and demographic variables like race, ethnicity, and socioeconomic status are really helping us to uncover some of the inequities in access to healthcare and behaviors that drive transmission. So I want to now shift and talk about how these data work and how we use them and access them. So prior to this year, I had spent many years working with mobile operators to look at data from mobile phones. And usually these were partnerships between mobile operators that had the data, academics like my group, where we've been working on the analytics, and then public health departments, whether that's, you know, national malaria control programs or whoever within the government. And to make that work, to get that data into a sensible risk map, for example, to help make decisions, first, there was a painstaking process involving the national regulator that regulates this kind of information, data use agreements being drawn up, institutional review boards within academia, of course, as well as ethics within the country you're working in. The Ministry of Telecommunications has to sign off, and then there's the whole Ministry of Health apparatus behind some of this work. So these have been complex negotiations, complex and I think probably too slow data use agreement processes. But the reason that we wanted to do this the slow way in the past was to make sure that we weren't cutting corners on privacy. And I think what's happened this year is that we've seen the floodgates open. And in particular, we've seen data, for example, from the ad tech industry and others, working directly with governments without necessarily going through these painstaking data use agreement and review boards and ethical regulator approvals. And I think that this represents a challenge for us, for the field, because we really need to think about how this data is regulated, who has access to it, how it's monetized, and how it will be useful in the future. So I want to distinguish between the different kinds of data in that context. So mobile phone data, which we call detail records, those are collected by mobile phone operators. And so whenever you use your SIM card, there's an approximate location. Here in this figure, we've got cell towers represented by the small dots, and we're following an individual person as they move around making calls. So you have a discrete time set that occurs whenever somebody uses their phone, and you can aggregate these data up to approximate flows of people between cell towers, but it's quite approximate. Then we have data from Google and Facebook and companies like that, where it's much more granular, and we have continuous time data, and then the company themselves aggregates it to a certain set of protocols, and then they share it with you. And then we have this ad tech data. And the concern here is that now we have multiple opaque processing steps that is very hard to really understand. So the raw data is generated by the publisher. And the coverage and representativeness of that data is very hard to establish, because then it's pre-processed and sold to a provider, and then often processed again and packaged and then made into mobility metrics. Now, disentangling exactly how those work and what they've done and what the representativeness is very challenging. So we've started to try to compare these different kinds of data sets for different challenges, different contexts. This paper just came out a few days ago, where we were looking at migration and displacement following Hurricane Maria in Puerto Rico. And we compared flight data, mobile phone data from CDRs, and Facebook data, for example. And you can see that all of these data sets, including the census approach, show a dramatic drop in the population, but they show different dynamics and they show different extent of the reduction in the population. So even when assessing your underlying populations at risk and your denominators, different data sets are going to have different, show different patterns and maybe be representing different populations and different kinds of movement patterns. And we really need to dig into this more and understand it. So we've been starting to do that this year. We've been comparing many different kinds of mobility data. Here on the left, we've got these different sources of information on human mobility. And then we're just looking at different metrics that each of these companies produce, spatial and temporal coverage, and whether we know representativeness. And in almost all cases, we don't really know representativeness. So in work with collaborators here, but particularly with my graduate student, Nishant Kishore, who made these figures for me, we're looking at correlations in one place over one period of time between all of these different metrics, between the different data sets, to try to understand how they compare to each other. And they do correlate, but there is certainly heterogeneity. I wouldn't worry about this graph too much, except to show that there's variation, and in some cases, there's a negative correlation between the metrics, and in some cases there's a positive correlation. So it's not perfectly intuitive, and especially when we're thinking about communication with policymakers, you have to be careful about how you interpret these metrics. A big issue is missingness. And so here we have, we've divided up the country into large central metro areas all the way down to rural locations. And we're looking at all these different metrics put out by different companies. And then just showing the heat map just shows the proportion that aren't, that are NA. And what you can see, first of all, is that as you move from the urban large central metro areas to the non-core, to the rural areas, the missingness increases a lot. Our reliability of these metrics and the mobility data change. You'll see that the safe graph, these SG, these are safe graph data, they don't report any missingness. And that's because they're doing a data imputation step. And so we have no way of knowing really what's going on underneath that. If you look at the coverage in a state where we do know it, you can see that the different data sets, this is Canva systems on the left, which is a bunch of different ad tech data aggregated, Facebook in the middle, and SafeGraph on the right. They show different coverage on a spatial scale as well. And so trying to understand how to account for these biases is challenging. And then finally, if we look at the epidemiology and try to measure how it's changing in relation to these mobility metrics, this is work done with Nick Menzies and Nishant again. The pink lines here are the fitted reproduction number estimated just from mobility data in different counties around the US. And the turquoise line is the reproduction number of COVID estimated from the epidemiological data using a nowcasting approach. And you can see that they fit relatively well. There's good correspondence. But again, they fit well, most in urban places, and it varies across the country. And sometimes it's hard to tell whether that's a data issue or it's a real difference between these two approaches. So I think there's a long way to go. I'm happy to discuss that more. And final slide, I just want to point out that the beginning of this year, actually, we wrote a paper where we really called for standardization, not just in the metrics and the mathematics behind how we calculate the metrics, but also in reporting of representativeness, in the approach taken to the baselines and boundaries for these data. And then I think for, most importantly, for a set of ethical privacy and safety frameworks that companies need to sign up to when they start to share these data to ensure that we're not risking people's privacy. And then lastly, I think we should expect a shifting association with the epidemiology. And again, we need to make sure that we're really keeping on top of methods there. This is a nascent field and there's a long way to go. So we shouldn't uncritically use these data sets. They are very helpful, but we still have a lot of work to do to understand exactly how to use them. So I will stop there. Thank you for having me, and I'm happy to answer any questions now or in the panel.
Thank you, Carolyn. By the way, it looks like we've solved our video problem. So if you want to share your video, go right ahead. Thank you. So I might ask a question here, and then we'll have a broader discussion with the entire panel. I guess I really appreciate the focus that you're bringing to the non-representativeness of the data. I think that's really important, and calling for more quantification of that. I wonder how do you communicate that when you're communicating the results of these analyses, and those are getting broadcast in technical and popular news articles? How do you go from the fact that we don't really know how representative this data is to the conclusions that we're drawing from it and the need to want to take action on it? How do you reconcile the uncertainty with trying to give people information they can act on?
So I think that there are two answers to that. The first, I think, is more of a structural thing where something that has been very valuable this year has been an iterative relationship with policymakers. So it's not a one conversation and then they just get these metrics. It's a continuing conversation so that their data literacy improves and you learn more about where it will really matter that you may have missingness and so on. So the iterative relationship between academics and policymakers, I think, is critical for that communication because it changes over time. And then the other thing I think is that, we have a responsibility to be very clear about uncertainty in all of our results. So just as COVID forecasts should include confidence intervals and we should, as a community, explain uncertainty and have caveats when we present these things. And it should just be, I see these data as one part of a surveillance system. They complement all the other information that policymakers have. They're not the answer. And so I think all of us have seen scientific articles, at least, that have just uncritically used these things as if they're true, which is strange because we wouldn't use any other data set in that way. So I think it's partly their novelty and so people aren't used to working with this data, but I think that there will become an increasing understanding that you have to communicate uncertainty through, calculating it, demanding it of the data providers and so on.
Great, thank you. I'm sure there'll be more questions along those lines in the discussion at the end. But we're going to move on now to Luca Ferretti as our second speaker. Dr. Ferretti is a senior researcher in statistical genetics and pathogen genomics in Christoph Fraser's group at the Big Data Institute at the University of Oxford. His research focuses on the interplay of epidemiology, genetics, evolution, and within host dynamics in HIV and other viral pathogens such as FMDV, ASF, and SARS-CoV. His seminal work on digital contact tracing for COVID-19 epidemiology has provided the key evidence for the development of contact tracing apps. He is a member of the Task Force Against COVID-19 of the Italian Ministry of Innovation and the Test and Trace program in the UK, and has actively supported the development of contact tracing apps in Italy, England, and Wales. Dr. Ferretti, please take it away.
Thank you very much for inviting me. I actually took the place last minute of Christoph Fraser, who would have probably I've been very glad to be here, but unfortunately we had some last minute issues with the regulatory authorization in the UK for several tests, and he had to devote himself to that. So I will discuss a kind of data that is some way related to mobility data, but is much more subtle and much newer in some sense. The use of mobility data at this scale, as Caroline noticed, is quite new, but the kind of developments that I'm discussing here are literally this year's developments. So let me go briefly to the point. We all know that SARS-CoV-2 is a virus that is quite similar to SARS, but not so. A key similarity is the fact that both viruses are, say, rapidly spreading, but not so rapidly, with a typical reproduction number of 2, 3. So essentially, each infected person generates 2 or 3 infections. And there is a lot of super spreading. So many people do not generate any new infection, and some people infect a lot of other contacts. And these features are both in common for the original SARS and the COVID-19. So the key issue with this epidemic has not been so much the fact that the virus is especially infectious, but it has been the fact that infectiousness is not the only factor that makes an infection controllable. In this seminal work in 2004 by Fraser, Stephen Raleigh, and collaborators, it has been shown that there are 2 factors that control if you can control an infection. One is, of course, how fast the infection proceeds, the basic reproduction number. But the other one is what is the proportion of infections that occur without symptoms, because these infections are very difficult to stop in practice. And of course, things are harder to control. The higher is their infectiousness, their reproduction number, or the higher is the fraction of individuals that actually pass the virus without showing any symptom. We did an analysis early in the epidemic that has been confirmed several times, having a look at how transmission of the virus is shared between the pre-symptomatic stage, the symptomatic stage, the fully asymptomatic stage. And the truth is that if you look at this plot that shows infectiousness in time since the time of infection, the largest part here is infections that occur before the onset of symptoms, that are about half of the infections. So alone, they represent a major problem. And there is also a fraction of infection that occur without any symptom at all. And yeah, the latest data show here that the greatest majority of the infection occur before symptoms, or just at the onset of symptom where it's too early to act, because testing, unfortunately, is not rapid enough for now. So in the 48 hours while we wait for test, you have an extra boost of infections. Now, what is the solution to all this? Well, it's clear that this is one of the main issues regarding this virus. So you have to stop transmission, either with the general preventative measures that are essentially mask usage, physical distancing, and so on. And this relates very much to the standard mobility data that Karen discussed. So people have to stop seeing their contacts, to stop moving around, and to use basic measures of physical distancing and measures like masks during their contacts. But to prevent further the spread of the virus, the only other way is to stop the virus, not at the generation where we see the symptoms, because that's too late. You see, when the individual becomes infectious and symptomatic, if you stop the individual at this point, the individual has just passed the virus to someone else, and you are going to have to catch up with the virus. The solution to do this is actually finding contacts and stopping them. The procedure that is usually known as contact tracing. Oops. Okay, I lost a piece of the slides. So the idea of contact tracing is very simple. The idea is that if you are infectious and you pass the virus to someone else, the individual that is symptomatic has already transmitted the virus, but the individual that has just been infected can still be stopped from transmitting the virus forward. To do this, you need fast testing to stop this one from infecting further, and then finding its contacts. And there is where a critical point has been made, because usually the process of finding contacts is a process that is quite completed. It's quite involved. It requires very specialized contact tracers with excellent skills. It's labor consuming in terms of time and human resources. And overall, it's a process that it's hard to make it effective for COVID-19. Apologies, but the slides changed completely for some reason, so I'm going blind. So this is the scheme, the conceptual scheme to improve these approaches with digital technologies. So the idea of contact tracing actually is simple. Essentially, what contact tracers do is that they find out for a given individual what are his contacts at home, when possible, but that's more difficult, in public transport, during working time, and so on. Then these contacts should be advised to quarantine for several days in order to stop spreading the virus further. Now, the reason for speeding the process is that finding these contacts takes time. But these contacts can be recorded automatically via technology. And this is a quite different kind of mobility data with respect to the kind of data that you're used to. Because here we are not talking about literally where you are or where you are going, but we're talking about who you are in contact with. And the kind of technology that has been the basic one to do this is Bluetooth Low Energy. So essentially basing this on mobile phones and contacts between mobile phones. What Bluetooth Low Energy does is essentially exchanging keys between phones, so the two phones know that they have been in proximity with one another. And if all these individuals have an app on their phone who records all these keys and these contacts, the day an individual awakes with fever or other symptoms and requests a test, and it is shown to be positive for COVID-19, this app can send an instantaneous signal to all the individuals he was in close proximity with, telling them to isolate for 14 days, and possibly even advising some individuals who were not in so close contact but could still be at risk to use enhanced precautions and enhanced social distancing for a while. So this was the idea. It was a relatively simple idea, possible right now because the technology of Bluetooth Low Energy was mature enough. and to cover all around the world, especially thanks to the Google Apple exposure notification system that has been essentially a common framework that all international apps have been able to use to record these transitions in a privacy-preserving way. So contacts are recorded in a completely privacy-preserving way. The information stays within the operative system, is not even accessible to governmental apps. Only governmental apps from public health authorities have the right to access this information with the consent of whoever is actually using the phone. And then the information can be used to reconstruct the contacts and alert the contacts without never knowing who these contacts are. So the whole process is actually done in an excellent way from the point of view of privacy. One issue of these technologies is that to be really effective, they require active user involvement. So they require users to download the apps, to install them, to keep using them, so to keep the Bluetooth active, for example. And as you see, this has been now employed in many countries, and we are considering both Google, Apple, and the users of other technologies, like the Indian app. We are, I think, several hundred million users. Despite that, in many countries, you can see that the percentage of people, well, adults in this case, using the app is relatively low. So Italy, on which app I actually worked, is around 16%, well, 18% maybe of the adult population. A bit less, I think, but we are there. England and Wales have reached 40%, which is not bad. Ireland, essentially 50%. Overall, these numbers are not especially interesting in terms of epidemiology, literally, because this means that you still have a huge penetration compared to many other apps in the population, but a relatively low one in order to stop the epidemic. As a reference, the penetration to be needed to stop the epidemic is about 50% of the whole population. So Finland can get close to that, but many other countries are not. And this is one of the major issues of this technology. The other is that the technology is quite new, so it's still evolving at a very, very fast rate. And there's just been a new version of the Google Apple exposure notification system, and there keep being adjustments. The reason why it's important to adjust it is that it's important to calibrate it in such a way to quarantine so to avoid quarantining as many people as possible, but still to quarantine all the people who are really at risk of having contracted the virus. And you can calibrate the curves for the risk of transmission depending on days post-infection, and especially days from onset of symptom on the index case that you know. And there is a lot of work on risk scoring depending on these parameters and more. You can wonder, do these technologies actually work against COVID-19? This is an important question. So we run a pilot in the Isle of Wight. You can see it here. Is a relatively small island but not so small. Some tens of thousands of inhabitants on the south coast of England, and it had just going to the results. Oops, let's do here. So the estimate of the reproduction number, which was around 1 for some time, dropped after the introduction of a systematic program for test and trace, which included human contact tracing and app-based contact tracing. And you can see in this plot that essentially the Isle of Wight went from one of the worst regions in England when the tracing was introduced to one of the best ones, shortly after, in a matter of weeks. So a quite effective demonstration of what contact tracing, together with the involvement of the community and so on, can actually do. Contact tracing is a complex endeavor because we are not working on a physical space as mobility data, but we are working on social networks, physical social networks, the people who you meet in real life. And this is much messier than the models usually assume. So usually transmission trees are thought to be, oh, okay, someone has the virus, passes it to another couple of people, who passes them to another couple of people. Yeah, and then this person, for example, passes it to a few contacts. Some of these are traced, some of these are not. The real picture like this one. We have a lot of social interactions in time. They are quite messy. And when the virus enters a social network, it starts spreading around and moving around in such a way that it's much less clear to understand who is at risk and who is not. And actually what the app does is it tends to quarantine many people in these networks, protecting both the ones that have been quarantined because they could spread the virus, but protecting them also because it tells them that, look, the virus is within your social network. And this is, so the app is actually also protective in itself in real world networks. We run simulations to try to understand what was the impact of the app, what the potential impact of the app in realistic social networks. Some collaborators had been fitting the model to the epidemic in Washington State. You see an effect of the app. The reduction, the more you use the app, the more you have a reduction. It is approximately linear with the number of people actually using the app. And of course, if you really want to stop the epidemic, you have to add on the top some reduction in mobility. So the app itself is not a solution, but it's part of a strategy in this sense. And of course, it plays well jointly with manual and digital systems. So what I've shown you the example of the Isle of Wight, where there was both manual and digital contact tracing. And even in simulations, if you put them together, they actually improve significantly the results. And speed is the most important thing. The most important point, because essentially you have to find the contacts before they transmit it. So the whole process should take 24 or 48 hours. And again, the structure of network matters. The more the network is localized in terms of clustering of contacts, the better actually the app works. And in fact, in some countries with very low uptake, such as Italy, the app works surprisingly well because of these network effects. So just to summarize, the dynamic of COVID-19 transmission supports the use of digital contact tracing in addition to the manual one, but it really needs to be fast with fast testing. And what these digital technologies can do is essentially recording contacts and automatically notifying them. And this is a public health measure. It is not a piece of technology and should be understood like that. So the whole process should be interpreted as a public health measure, including looking at the adherence to quarantine and so on. And of course, the speed of testing. And other public health measures should be seen as complementary to this one.
Thank you, Luca. And this looks like the team. We want to give credit for the great work. So thank you for that. A few quick questions for you before we move on to the third speaker. I guess the first question is, have you quantified, or has anyone quantified the value of the digital tracing over the manual contract tracing that used to be done? You know, what is the value in the digital version versus, you know, kind of the old school, just having people list their contacts?
So it is very difficult to actually quantify this because the whole digital contact tracing has been built for privacy. So it has essentially been built not to let the people who develop the app or the epidemiologists or public health experts know anything about the system. This has been a conscious choice, a political choice, I would say, which is fine, but means that we have very little data on how the system works. To my knowledge, there's been only one experiment that has been epidemiologically validated, the one in the Isle of Wight, where we don't know the contribution of the manual versus the digital tracing. There's been an experiment with the fake infections in Spain, the pilot of the Spanish app on the Canary Island of La Gomera, where they have found that they found twice as many contacts with the digital tracing than with manual one. So it was about, they found about 3 contacts per person manually and 6 digitally. And then there is some good work from Switzerland, where Marcel 10 collaborators have looked at how effective this technology is compared to their contact tracers, the human contact tracers that they have. And they found out that the technology is as efficient as human contact tracing overall, but of course it has the advantage of being complementary. So you're getting extra contacts on the top of the ones that you can already find by manual contact tracing. Mm-hmm. So these are the only actual data that we have right now. Unfortunately, Google Apple's notification system does not give back to the developers much information to work with.
Right, and that's good. I guess it's good that the digital ones find more, and hopefully, we can study to see how accurate those cases are with future studies. Thank you very much for that. We're going to move on to our third speaker. Our third speaker is Andrew Schroeder. And Dr. Schroeder is the Vice President of Research and Analysis for Direct Relief, a nonprofit organization delivering over $1 billion of humanitarian relief around the world annually. He specializes in data-driven aid by bringing geographic information systems mapping, epidemiological analysis, and other informatics tools to humanitarian efforts. Through this work, Dr. Schroeder advises the United Nations Development Program and the World Food Program. Along with Dr. Buckee, he was one of the founders of the COVID-19 Mobility Data Network. Dr. Schroeder, you may begin your talk. Thank you.
Thanks, Chris. And you can hear me okay? I'll go ahead and share my screen. Oops. 1 second. All right. I will. So I'm going to try to keep this relatively brief. I know we're at the end on time, and I wanted to talk a little bit from the application side and the the social process side on a lot of this data about something that I've been thinking a lot about over the last several weeks as we kind of wrap up this crazy year where I feel like we in the humanitarian community in particular, although I'm sure you guys too, feel like we get no rest at all. And to think about what it means to say that this type of data has an impact on the problems that we are trying to solve, in particular mitigation of COVID-19 cases and deaths, other impacts on the health system, and then going forward, even as we think about the next round, which is going to be around the implementation of the vaccination effort and the maintenance of a lot of the non-pharmaceutical initiatives that have been that are going to have to continue throughout that process, and to look at the way we got from the COVID-19 Mobility Data Network into its most recent evolution, which is called the Crisis Ready Project. So, Carolyn may have gone over a little bit about this so far, but I just wanted to think back about what was or what is the COVID-19 Mobility Data Network, and how do we get towards like the assumptions behind this idea that this has an impact on these problems. This was convened back in March. It was geographically centered in a way that makes a difference. Actually, in the US, it was distributed and global in scope, but disproportionately US, with this mission to leverage mobility data for pandemic response. So not just a research network, but an operational network. This is principally, although not exclusively, I'm not an infectious disease epidemiologist, composed of these folks, which are, we couldn't have done any of this sort of things without them. I want to note that this was voluntary. It's unpaid intellectual labor, and I'll come back to the meaning of this later on. Built from two overlapping, interlocking networks. In this case, one of the starting points was Facebook Data for Good, where there were a set of data agreements in place, and a lot of people have used the Facebook Data for Good data as kind of a foundational point for a lot of this analysis. And then specifically Dr. Buckee's professional networks, which allowed us to kind of grow quickly into this space and enlist people into this effort. And the network is designed in that sense to translate between a lot of these different communities. The data itself would not necessarily be meaningful in the same way without this translational effort. And here's, it's not that large, but it was a relatively widespread agency effort, really at the municipal and state level, not at the national level, except in a couple of country cases. And I'll come back to the significance of that too. This was kicked off in many ways, and I think that it was important to start this around a statement of principles, which in this case was a letter that many people signed on to, that appeared in Science. And when I went back to kind of look at this, when we were looking at like this question of impact, in this third paragraph, there actually is a statement about what we were assuming to happen, what would be valuable in terms of the use of mobility data for the response to the pandemic. This idea that, we can estimate aggregate mobility flows and link them into mapping for understanding social distancing messaging, linking to development and implementation of policy on mobility patterns, actually work directly with public officials at the county or other levels, to understand that. So an assumption around who actually will be utilizing this, and the ability to actually receive those messages around the data, to engage in comparative analysis on different interventions. I think there's a lot of that that's gone on. You guys have probably talked about a lot of that even today. And then, to link into this issue around targeted reopening. So, to the best of my knowledge, there's not actually a lot of good evidence that the mobility data is literally being used around targeted reopening analysis, but it's an important idea, and it's something that we kind of baked into the beginning of the understanding of what was this for. And I think right at the beginning was this idea of what we've come to call crisis readiness around the social impact is not composed of only one factor. It requires linking these things together. There's obviously this data piece that's crucial. You have providers from a number of different sources. I think actually at the outset, it's remarkable to me how little all of us really knew about the production process on the data. And this has been one of the most important things to be kind of revealed over the course of this year. The idea that methods need to be in place in order to utilize this data, but the methods need to be actually established in some kind of operational time frame, and then that these translation networks are established and maintained in some way. We have data aggregators and providers on the one hand, we have networks of researchers and analysts, and then we have networks of public and nonprofit agencies, all of which are kind of, we're trying to stitch together in some way in order to achieve what we then call the impact of this data. And there's a set of really specific things that are required in each case. There's a set of data agreements and really specific data pipelines that are required in order to operationalize this data and to do it in a way that adheres to privacy, data protection standards, individual questions, but also community questions. A repository around the modeling and the scripting that makes it possible to transform this into something that actually could be translated, and then a set of operational relationships which did not actually exist in any kind of formalized structure when a lot of this work began in March. Actually, it's remarkable to me in retrospect, actually, how much of this is produced through a kind of ad hoc voluntary process that creates a constituency and a set of possibilities for being able to translate something. There's a lot of demand for it, and there was a lot of change that happened in terms of how this is received. But the organic nature of a lot of that development is sort of important. So if you think about this, and you kind of back out to that paragraph, what actually were some of the assumptions that we were making around the impact of this data? I think the first and the most important one really is this idea that it actually can. The data collected from digital devices, creating GPS traces, moving around, can and should be safely transformed into useful analytical products relative to privacy and data protection. And I think obviously we decided this is a good idea, and all of us in the audience agree with this. But this safely part is really important in the sense that you're talking about data that has in some ways a really specific and distinctive capacity to not be safe, to reveal dynamics about people and communities that otherwise would be inaccessible. This is why we want to do it, but it's also what makes it kind of uniquely in and of itself a kind of public health problem. We make an assumption that we actually can do this analysis, the requisite analysis in time to actually be operationally relevant. And this is something that, in the humanitarian space, we are dealing with time-sensitive issues all the time. And, a lot of things that are important research questions actually get pushed to the side often simply because they can't be accomplished within the framework of the operational unit that's required to move ahead with practical solutions. That operational relevance in this case, and this is, I think, the assumption of what we were trying to accomplish, was around that this would be valuable specifically to accomplish a set of goals that would be authorized by doing this work: policy monitoring, strategic message targeting, and then this tactical planning around, open up some neighborhoods versus others, understand connectivity between these spaces, and make sure that we could, build reflection around, the shifting risk as you would see shifts in mobility relative to things like contact and case rate, and et cetera. There was a lot of demand that was encountered around epidemiological modeling, but there are, and Carolyn speaks to this better than anyone I know, around the reasons not to do some of the modeling work in this operational context, or to be very cautious about whether that actually may be the most significant operational question with the use of mobility data. Does it actually proxy for things like contact rates? Is it actually telling you what you think it is in a way that could be decision relevant? And then, we make an assumption in these translational networks that our analytical contacts actually can be linked in some way that we know to the decision context. In some ways, this is like you have to proceed in a way that you don't actually fully know this, but there's a lot of advice that's dispensed and a lot of input given into public health departments, mayors, governors, the Centers for Disease Control, et cetera. advice is not actually known in terms of its how its uptake actually occurs into decision context. And this is something that we're going to have to think about really carefully going forward as to who actually is learning from mobility data. And I think finally, like, we have this assumption that these networks can actually be sustained long enough over time to provide the value that we need to provide. Given the duration of the event. I actually think that we were not really clear in the case of COVID what the duration of the event was going to be. And in most humanitarian contexts, there obviously is a long-term tail of consequences to hurricanes and to other kinds of crisis events. But the peak of those events is actually relatively well known, and it's a limited peak. So there can be a triaging of effort around the networks required to respond to them. In the case of the pandemic, this has been, I think, one of the longest standing challenges. It has a data challenge specifically around opening up the access to the data in a nearly open-ended kind of framework that I don't think was ever intended, quite frankly. And to be able to sustain the effort required on the part of the analysts and the health response community to actually utilize this kind of information and to make a set of ongoing operational decisions given it over a very long period of time. This is in some ways coming back around to this voluntary question. So if we go back to some of these assumptions and just break them down really quick, and I won't spend too much time on this, but when we think about this issue of whether it can and should be safely transformed, I think we need to think of a set of questions around here that I think I've learned a tremendous amount over the course of this year, but which really required a learning process, and that may still to this day not be fully well understood. The process whereby this data is created requires a whole series of steps. It requires the actual movement of people all the way through to the selling of data in advertising frameworks, that includes Facebook most particularly, and then outwards towards the ability to actually run metrics on this information. That process is not something that is intended for the reasons why we're using it, and therefore implies a fairly high standard, I think, actually, for how we ought to approach the open-ended use of this data for solving public health problems. It implies quite a significant bar, I think, in terms of the use of the scale of the data in space and time as to how we apply it to these problems. So there is a significant debate about the access that we have in terms of granularity, spatial and temporal, and then the need to set an appropriate scale that actually controls for the very serious safety questions in this kind of in this kind of data. As we've seen, actually, differential privacy for any given data set is one of the ways that we control for the safety of this data. But I think we now are faced in the mobility data space with an embarrassment of riches, where we did not actually expect to receive Facebook and SafeGraph and Cubics, multiple large-scale data sets that are all measuring variance on the same thing, and we can integrate across them. And that has significant consequences for how we think about the secondary revelation of community and potentially individual patterns as we go forward, linking across these high-resolution mobility data sets. That's not, again, just an individual question. It really is a community question. This came up with a vengeance during the course of the summer as the kind of dual use of mobility became really foregrounded around monitoring the policy implementations around distancing, particularly with the wave of cases that happened throughout the South that really consumed a lot of attention during the summer, with the civil rights and protest movements around police violence and around opportunities for state surveillance that use a lot of the same techniques, and how we differentiate those questions becomes really central to whether or not the analysis that's done from this data will actually be able to accomplish what we need it to accomplish in a safe context. To just really quickly on this time issue, there's obviously this narrow window for when certain decisions need to be made, and a bit of a sacrifice of some research time to answering these operational questions, that the answer often is dashboards. And we did this ourselves in partnership with Facebook around building a dashboard to look at the movement range data, which looks at likelihood of individuals leaving their home area or staying put, as a way to automate some of these processes. It's really worth thinking about whether or not, especially given the safety issues I talked about earlier, whether that's actually a good idea in every context. Is actually automation of this data the relevant approach, given the need to intervene in some of the decision making around the ethics and privacy and data protection issues? Looking at some of these tactical questions around operation of social distancing policies and thinking about messaging, I just wanted to flag some of the work that's ongoing. This is looking at the city of Syracuse and the process that the data team there went through to be able to utilize Facebook to manage their distancing measures in Syracuse. A good example of the direct application. One of the things that's important to bear in mind is that this was actually done by a team that was not in the health department. It was done by a team that's in the data unit for the mayor, and had to be kind of really carefully thought through in terms of the way in which different parts of the city interact around the use of data to solve certain kinds of public problems. And this, leads into, I think, this question around how we understand the context that this is actually being put into. This is a very diverse context for uptake of mobility data for public problem solving. We look at anywhere from UNICEF around the planning that UNICEF was ongoing through multiple different health departments, Direct Relief itself, which is dealing with health resource allocation decisions, not really administration of distancing. And each one of those has a different set of decision contexts for how they actually approach this information. A wide variance in capacity in terms of whether they can do a lot of this analytical work themselves, or whether capacity building has to be done in order to be able to move their work forward. So I think this is one of the key lessons around the need for institutional research as part of how we think about applications and development of the data applications for distancing analysis going forward. And I'll just kind of conclude some of this around looking at this issue around sustainment of networks. This actually doesn't work. I've been part of a lot of these networks over time. Digital Humanitarians is one of the first ones I've participated in, but we model some of this kind of approach around the network approach that emerged through the humanitarian community, at least I did, but thinking about how you support researchers to participate in networks is just as important in many ways as part of this translational effort as the data pipelines and the methods. People who jump in to support may not be actually compensated for the work they do, which is part of the public service approach towards data for social impact. That's easier in a short term than it is in a long-term approach, and this has been one of the hard limits, I think, around a lot of these more operational applications systems. But in the space that then will exist as we try to think through these sustainability issues is the global consulting industry, which is doing a lot of the same work under very different kind of circumstances. And so as we kind of look at these applications, we need to understand that we are in the same space and that we don't have the same resources. So where those support operations can be kind of organized and maintained to make it possible to support people for this kind of effort, we need to really think that through as part of any kind of next wave of effort going forward into 2021. And this, I think, really brings us into the evolution of this towards crisis ready, which is born out of the taking the same kind of folks that have been involved in this, looking at intersectional issues around disasters and public health that prompted the use of mobility data for response in the beginning, but frame this around particular areas of activity where we can sustain this over a period of time and build out in a really deliberate way translational networks that can be sustained and can be supported in a wide variety of contexts going forward. So, the concept here is to then have data that is already established within a kind of privacy and data protection framework where open differential privacy is being applied both within data sets and across data sets to solve for, I think, the safety hazards that are associated with the use of this kind of surveillance approach, where that's linked into operationally useful methods and models where they're obviously accurate and they're peer-reviewed and they're established, but where they're clearly also able to be used by decision makers for specific purposes, and where we've tested those out in decision contexts, and then the establishment of translational networks from the beginning across the kinds of actors I've talked about already, but really I think which push into global equity questions and global capacity building, so that we can inform at all levels of these are in many ways global data sets. We don't have useful global models in place for how a lot of this kind of work will happen in the future, and we need to kind of correct for that in the next round. So
Andrew, I thank you very much. I think we're a little over time, and I want to make sure that we get a chance to get to a few panel discussions. A quick question for you that I'd like to ask is, you talked a lot about operational relevance, and I think that's important to have as a focus. Can you share with us any specific interventions that have been made by decision makers? I mean, maybe your Syracuse example is a good one to point to something that was a specific action that was taken from the results of these studies.
Yeah, there's several. I mean, the Syracuse example is a pretty good one in the sense that they were, looking at tracking, change at the neighborhood level in terms of the reaction to the policies that were being implemented. So the action in this case is that, policy is implemented, movement restriction goes into place, and there's a monitoring of the population reaction, and then movement restrictions were adjusted on the basis of looking at the population reaction. So in the most simple case that I think is what we're looking at in terms of operational relevance. It's that a kind of feedback relationship in the imposition of some of these movement restrictions. the state of California, was looking similarly at health messaging. So when you look at areas where you see variance in, mobility, given the policies that are being implemented around, don't do certain things, certain areas might be elevated over others, messaging that's targeted at certain places, given the change in mobility, there's practical impact of that. Now, whether it actually achieves the result of reducing contact and actually mitigating the case counts is actually a different question, and it's a little bit hard to know whether or not you could trace that all the way out to where it needs to be. So, but the decision context becomes at least clearer around this.
Great, thank you. All right, I'm going to ask a few questions, and hopefully the panel can weigh in, as needed. You've each, obviously, by the way, thank you all. Great job, great talks, very informative and interesting. They tied together well. Each of you talked about privacy as being an important aspect of this, and I think we all realize that and understand why that's the case. And in the case of the mobility data, it's anonymized. In the case of the contact tracing, we have anonymous apps. But still, how do we first of all, how do we convince ourselves that privacy is really what we think it is? And second of all, how do we convince a skeptical public this data is being collected either from big tech companies that already have public trust issues, and maybe more in some countries than others, and in other cases being collected from some of the ad tech companies that are operating maybe below the scope of what the public realizes they're collecting. So I wonder, maybe we'll start with Carolyn, how you see the issue of public trust in the privacy of these studies. How do we deal with that, and how do we increase that public trust?
Yeah, I think this is a really central question to all of these approaches. I think one thing that has been good about this is that people are becoming more aware of how their data might be used, and these kinds of data sets, because they're just more in the public eye. And I suspect that what will need to happen is that there's much more transparency about what people's, what is being collected, what is being done with it, and on what granularity. I think most people would not object to highly aggregated use of their data, but they might. And in fact, for the Facebook data, for example, you have to have your location settings switched on. But I think when you get down to these more granular data sets where people might not be aware, I think that the key is transparency and communication, and having some discourse with the public, to try to make sure people do know. And I think one of the challenges, of course, is that we all have about 1 million things that we have to say agree on our mobile phones. And people are agreeing to things that they don't really know what they're agreeing to. So actually, I think what's critical is that as a community, scientists, policymakers, data providers, we come up with some standardized guidelines to say, so that the public can know that this has been thought about, that there are some ethics and guidelines that are regulating these processes, and that they can go and find out what they are, and that there's legal backup as well. Because one of the things that's really missing here is any kind of legal frameworks for regulating these data. So we really have to sit down as a community and figure out those guidelines so that the public can start to realize what their data is being used for, and have that discussion. I think we just haven't had the discussion yet, and it needs to happen.
Just to build on that really quick, I had a recent conversation with a research group in Latin America that was providing direct advice on mobility into the government in their country as part of COVID. They actually had access on the Facebook side to the much more granular data and the highly aggregated data that is open data that appears through humanitarian data exchange. They were only using the highly aggregated data. And I asked them, like, why? You know, you have a lot of other data, you know, why wouldn't you actually use everything that you have at your disposal? And their answer was that the public perception of the surveillance power of the state tied to a company like Facebook was so great that if they were to have used the other data source, they would have had to actually go through all kinds of explanation as to what it is, what it means, how it's collected, you know, et cetera, et cetera. And that messaging problem outweighed whatever they thought the analytical benefit would be to using something that was, you know, at a more granular scale. So they were like, the other stuff is actually in an open data framework. We still have to explain some of it, but we can actually make a set of claims specifically about how it got into that open data framework. And that seems like a really crucial message that around this transparency point, that it outweighs the granularity of the data in the analysis. And they were getting good decisions out of it too.
That's great. You know, it kind of plays in the individual's role in public health, right? The good for an individual versus the good for public health. I wonder, to Luca, you know, as you saw in these different countries in your study, the different adoption of the contact tracing and how it was being used, what can we learn about how different countries approached trying to get people to either opt in or compel them to opt in or require them to opt in? You know, what can we learn across all of these different countries that would enable a skeptical country like the US to maybe be able to use these technologies in the future?
It's tricky in the sense that many countries had very low rates of adoption, especially until they saw the epidemic growing back in the autumn. So many of these apps were launched during the summer. They had an initial uptake, then they stopped, and then there was a second wave of uptake in autumn, corresponding to the fear of a resurgence of the virus. So one of the most immediate things is that, of course, the perception of public utility of these apps is important. So if you are using data for something that is perceived as useful for the public, there will be much less mistrust. Still, a critical issue is that people are afraid of the use of granular data. So I can say that there was a lot of discussion in Italy at the very early stage of the pandemic, because Italy was one of the first countries to discuss the use of these contact tracing apps. And I know of one of my aunts who had left her phone forever at home for a few days while traveling around by car because she didn't want to be traced. This is a typical kind of approach, and it's an issue of lack of communication from governments in some sense, but it's also true that governments cannot do much during an epidemic to communicate effectively this to the whole population. So one of the issues I think is, as Karen was saying, being prepared in advance to communicate effectively. In the United Kingdom, we had a large communication campaign lately, which was quite effective, bringing the app among one of the most widespread in the country. Still not as high as we would have liked, but there I think the key was communication campaign, a well-designed one, a well-curated one. It took some time, so the UK was one of the last countries to launch a Google Apple notification system, but it was launched properly with a good communication campaign. The other point is a good communication campaign costs, of course, public money. That's an ingredient that is unfortunately there. The other point is public trust in governments. So Ireland was able to do a great job, especially because she based it on a strong relation of public trust, and same for other Nordic countries in Europe. Vice versa, when public trust was already low, the app was some way doomed. And one of the worst things has been, honestly and unfortunately, talking about the need for privacy. So the more the community has discussed the need for privacy, the more apparently adoption has gone down, not up, even if these apps are really privacy preserving. And the reason is that once some kind of discourse on privacy risks starts being out in the wild among the public, it's difficult to just say, okay, we have solved it, don't worry, trust us. It takes time. The fear that some of the private data have been used is very, very strong, especially for geolocation. So one of the issues with the contact tracing apps has been that one of the ideas was to use geolocation, so to activate not only Bluetooth but also GPS, and to use it. This has been touted as a no-go from the beginning for technical reasons as well. Geolocation is not precise enough for this kind of applications and so on, and there was the worry about privacy. But for many, many individuals, still, this kind of apps geolocate them, and this is something that nobody in Europe really wants. So there is a very strong feeling against even privacy-preserving attempts at geolocating individuals. It's not easy, but I think gaining public trust is a slow process. It has to be done step by step, and it's easy to lose. So I think that has been the key across Europe.
Great, thank
and
you.
Transparency.
Another question I have is, you've all mentioned about how this pandemic and this crisis has opened up the ability to see new data sets and, exposed the researchers to more data than they thought was ever possible before. There's obviously other uses for this data outside of COVID tracking. Some are related to COVID, like when should I open the movie theater or the mall? When are people moving around? Others are maybe, a little bit more tricky, like trying to track populations going to protests or various other events or various government surveillance uses of the data. How do you think we should balance that, as we hopefully approach the end of the pandemic soon? First for Carolyn and Andrew, how do you guys approach requests for those data or analyses of those data for other uses? And then more generally, how do you guys think about how and whether we should be using this data going forward post-pandemic?
So I think, we talk about this a lot. Obviously, we have projects related to natural disasters as well, which is when population displacement is critical for aid. For the diseases that I work on normally, like malaria and dengue and so on, the same data sets are useful for surveillance. And so the hope is that some of the systems that we've built and the data pipelines that we've built will be sustained in the context of public health and infectious disease surveillance into the future. And we won't lose these networks. We'll be able to sustain them in a way such that if there is another emerging epidemic, we're able to act quickly. So hopefully those pipelines will get refined and sustained over time, because their value is now clear, I think, to many ministries of health. Other applications, so Andrew talked about this issue of state surveillance, and we did have requests from law enforcement and so on. I think this is something that has to be really carefully thought about again, because at the moment, the onus is on the researcher to essentially say no to those requests. But a discussion has to happen about the appropriateness of different data sets and how necessary they are. So at the moment that, there's a sense that these data sets are great and we should use them if they're going to really help. Proving that to some extent, that's a judgment call. What does it mean really help? How much? In what context? Would it really help with other immigration issues? We need to really have that's an ethics and politics discussion as much as it is a research discussion. So while I hope that the frameworks we put in place will be sustained for infectious diseases with all the privacy and aggregation and everything, I think that there needs to be this much larger discussion about about other uses, and specifically who gets to decide that and who the gatekeepers are. I don't think that's clear, and at the moment it's a little bit Wild West.
I totally agree with that, and I also think that it's very challenging to maintain some of the boundaries around the data going forward. I mean, for instance, one of the things that we, you know, is a kind of standard for ethics around this would be time and purpose limitations on the data. But, you know, in cases where actually the event that triggers the release of the data is functionally open-ended in nature, how do you maintain time and purpose limitations around it? You know, in a disaster context, actually, in most parts of the world, disaster response is led by the military, and that's not something that you can institutionally avoid. We have to deal with civil-military relationships in humanitarian assistance all the time. How do you deal with civil-military relationships in the context of data relationships that may be actually driving some of humanitarian decision making? That's actually a pretty open-ended question, I think. You know, it was relatively straightforward when you're talking about engagement with public health departments, but even in those cases, public health departments face internal pressures around some of these dual-use questions. And so there has to be, as Carolyn was saying, a much more kind of vigorous public discussion about how to be able to put the right kind of ethical frameworks, decision frameworks, et cetera, into place around this, or it just gets thornier from here, actually.
Thank you very much. And thanks to our speakers. We're at the end of time now. Thanks for a really interesting and thought-provoking discussion on these topics. And you know, we'll all be following your efforts going forward. So again, thanks for your time and sharing your expertise with us. I'm going to hand it back to Joe to close us out.
Well, everyone, thank you for participating. You've been an engaged and very good audience, and we hope that we were able to provide some real value with this presentation. Thank the speakers, and please, everyone, pay attention to our website. We expect that we will have another data forum event sometime at the end of January or early February. Take good care of yourselves and your neighbors, and we'll look forward to seeing you next time. Goodbye.
Thanks, Joe.
Thanks. Bye.